So I'm Dr. Tanya Siddiqi. I'm a hematologist from City of Hope Medical Center in Los Angeles County, and I'm here at ASH 2019 in Orlando, Florida. I presented on the clinical trial TRANSCEND CLL 004 study, which is a phase 1-2 study in patients with relapsed or refractory chronic lymphocytic leukemia. Patients needed to have failed at least 2 or 3 different lines of therapy to be eligible for this trial, and they all needed to have failed at least one BTK inhibitor. It happened to be ibrutinib on this particular trial. That we enrolled 23 patients, and I presented on those 23 patients. This is the phase 1 portion of the study. We found that these patients, all of them had failed ibrutinib before. There were 9 out of the 23, or 39%, who had also failed venetoclax before, so a pretty bad acting group of CLL patients. They had advanced stage disease, high risk features of their CLL. And what we found was that when we gave them the CAR T-cell product liso-cel, which is what this study was investigating, they tolerated the liso-cel CAR T-cells pretty well. They did not have too many high-grade cytokine release syndrome or neurotoxicity type side effects, which we sometimes see with CAR T-cells. Only 2 of the 29 had grade 3 CRS, and only 5 of the 23 had neurotoxicity. All were manageable. The rest of the side effects of these 2 types were less than grade 3 in nature, so manageable. We also found that at the 30-day mark, when the first assessments were started and beyond, that the best overall response rate was 81%, with 45% complete remissions. We checked for minimal residual disease testing in these patients, and the best undetectable minimal residual disease rate was 65% in the blood and 75% in the 65% in the marrow and 75% in the blood, actually. And when you look at the double refractory population that I initially told you about, those 9 patients who had failed both ibrutinib and venetoclax novel agents before coming to CAR T-cells, their overall response rate, best overall response rate, was 89%, and their undetectable MRD rates were also very high, almost 80%. So excellent results in patients who had bad CLL, and the next question was, how long do these results last? So far, the median follow-up has been 11 months, so we still have a ways to go in how long we want to follow these patients. But in general, 10 out of those 12 patients who were in CR or PR at 6 months stayed in response at 9 months, and 8 of them are now out beyond a year, still in maintaining a response. There were a few people, 27%, who actually improved their response over time, so went from PR to CR or stable disease to a better response. So it seems like it's durable. We haven't found anybody who has undetectable MRD to now have become detectable again, so that's great. And the toxicities were manageable. So all in all, very good, durable looking responses. The phase 2 portion of the study is now ongoing. We're still enrolling patients, and as we gain more experience, I think that'll be best.